If your jaw hurts, feels tight, you notice that you clench or grind your teeth, or you have any pain anywhere on your face, you need to watch this video because I'm going to show you 3 exercises that I use regularly with patients and clients to improve these symptoms. And this especially works if when you open your mouth, your jaw deviates to one side or the other. You can get results like this client right here in 1 session. And that's because each of these exercises works on a key biomechanical principle that needs to happen within the jaw. Under normal circumstances, when the jaw opens, it also comes down and forward. But many individuals have a resting jaw position where the condyles, the top of the TMJ or the jaw joint, sit back and up. This reduces space locally in the temporomandibular joint and in some instances can cause discomfort. These moves will encourage the jaw to come down and forward, opening up space in the jaw joints and improving your comfort and mobility. The first movement opens this space by driving rotation through the jaw joint. Believe it or not, when you chew on one side or the other, your jaw rotates. This move encourages that. What you need is some sort of tube or gum. Chew on that tube or gum on one side. On the opposite side, you're going to apply pressure to the masseter muscle, which is that big muscle that's on the side of your face. It'll often be tender. Maintain this pressure and chew the gum or the tube. Do 20 to 50 of these chews a couple times per day. Now, the nice thing about gum is you can get brands that are actually a little bit tougher. This is called mastic gum. These gums have a resin in them that make it very difficult to chew, so you can build resistance over time. Some brands that I've used, not sponsors, are Mastique and Stronger Gum. Stronger Gum especially has progressive resistance that you can use to enhance the effect of this exercise. But I gotta warn you, the more resistance that you add into the exercise, the worse the gum tastes. The second move involves differentiating the tongue from the jaw. In order to encourage this forward jaw position, the tongue needs to be able to sit to the roof of the mouth. When the tongue cannot do that and it sits lower on the floor of the mouth, this causes the jaw to come down and back, which creates that position in your jaw joint that limits motion and can sometimes be uncomfortable. The solution then will be to encourage the tongue to move independently of the jaw. This works great if you are that person whose jaw deviates when you open. Whatever side your jaw deviates towards, so if it goes to the left, you're going to jut your jaw forward and apply resistance with your index finger in the opposite direction. If you get it right, you'll feel the side of your face on the left, in this case, work. This is your pterygoid muscle. Maintaining this pressure, you want to stick your tongue into the opposite cheek, in this case the left, without losing jaw position. If you notice that your jaw deviates with your tongue, you can make this exercise easier by sticking your tongue forward out of your mouth and then slowly swiping it to the left. If you have to do the forward and then swipe, try 2 to 3 sets of 10 reps a couple times per day. If you're someone who can push the tongue into the cheek right away, hold this position for 2 to 3 sets of 30 seconds. This last move works on your ability to open your mouth while keeping the tongue on the roof of the mouth. This encourages maximal space creation in the temporomandibular or jaw joint. You're going to stick your tongue straight out into a point. Press it up into the top teeth. You'll feel the sides of your tongue work. From here, you want to slide your tongue back and then try to suction it to the roof of the mouth. Make sure that there are no sides of the tongue spilling onto the teeth. You want to keep it between the teeth. Maintaining this pressure, you're going to slowly open and close your mouth without forcing the range. Make sure the tongue stays on the roof of the mouth. Do 2 to 3 sets of 10 openings with this move a couple times per day. And if you do these 3 moves, you should have a lot more jaw comfort. Now, if you struggled getting your tongue into those positions, you might have to do a little bit more focus work on your tongue range of motion and control. If that sounds like you, I would check out this video right here where I go into many exercises that you can use to improve your tongue range of motion and mobility.